Can you find anxiety in your body? What does anxiety feel like to you? I'm Dr. Brad Fanistel at BoulderMindBodyMedicine.com. This can be a fantastic question for anyone dealing with chronic pain, other neuroplastic symptoms, anxiety, but it's the first question I ask, or one of the first questions I always ask my patients who are seeing me with more of a straightforward, I've got anxiety problem. I ask them all, what does your anxiety feel like in your body? And most people can answer me. Most people think about it and are like, well, I know what it feels like. I got some tension in my chest or pressure here or a heaviness here or shortness of breath or my stomach gets a little gurgly or even nauseated. My throat tightens up. Pressure, tension in my neck muscles, pressure in my temples, something, jaw, whatever. But I have an occasional person who can't answer that question. They're coming to see me for anxiety, and I ask them, and they're like, I didn't come to see you for any of this stuff. I came in here for anxiety. My doctor told me you'd talk about it differently. It's right here. I got a lot of stuff going on. So that person, I ask them, well, okay, let me rephrase the question. The negative thoughts that you're having, the worry spiral, the OCD thinking, the thoughts that brought you in here, how do those make you feel? I've never had anybody ever say, I feel fine, I want to get rid of the thoughts. I've never heard that answer. People are in the doctor's office because they feel like crap. You can't fix what you're not looking at. We're going to look at the bodily sensations of anxiety in order to adjust them. As I like to say, you can't fix what you're not looking at. Remember, we're looking at anxiety through a different lens than the outdated, ineffective biomedical model, which sees anxiety as a disease. Using this outdated model, why would we ever turn towards anxiety? It's a disease. It's a problem. Who wants to go towards that? We need to get rid of it. But it's actually more important to think of anxiety as a protective alarm from the brain to the body. Your protective alarm of anxiety might feel like it's stuck in the on position or the hair trigger position, but at its root, it's a protective alarm, not a disease. This is a protective neural circuit. And these neural circuits are coming from a primitive autopilot part of your brain that you don't have direct control over. We need to actually look at the bodily sensations of anxiety. We do this by turning towards the body because bodily sensations are the language of the autonomic nervous system. Turning towards sensations of pain, anxiety, tension can be super difficult. These are unpleasant sensations. So I like people to start not by addressing their big anxiety or their big pain, but start by addressing the sensations that your autonomic nervous system is sending to the body all day long. When you're not specifically super anxious or in a lot of pain, can you start turning towards the body when you don't need to, when nothing big is going on, just checking in with the autonomic nervous system? You can check in with your overprotective, primitive survival brain very easily throughout the day, and you can do so in brief moments here and there throughout the day. This is a really powerful way to retrain the brain. The part of the brain we're trying to teach here learns by experience and repetition. It's an experiential learner, which is how my autonomic nervous system got the way mine is, how yours got the way yours is, a lifetime of experience. We want to start giving it the experience of having these sensations, but without any fear. And there are ways to explicitly practice these exercises so that we can experience the sensations without fear, and it's often easiest to start with sensations that aren't super severe. So I'm a big fan of just checking in with bodily sensations throughout the day. We can do an exercise right now, and this is, I talk about two different exercises you can do, and here's one of them. This is just a body check-in. I just call this a body check-in. And we're not trying to do anything here. We're not trying to fix anything. We're not trying to calm down. This is not an exercise to be used when you're in panic attack and how to get out of it. This is a brain training exercise, and we do it throughout the day, just here and there throughout the day. So join me with this one. It'll take 75, max 90 seconds, I think. Join me with this little quick body check-in that you could do here and there throughout the day. If it helps, you can close your eyes, if that helps you concentrate. And then just stay with me here and note to yourself. We're just noticing, what sensations can I feel in my temples, if anything? What can I feel in my jaw? Left, right. What sensations can I feel in the back of my throat as I breathe gently in and out, if anything? My neck and shoulders. What is here to feel? My chest. My abdomen. Any sensations in the abdomen as I breathe in and out? The pelvic floor. Done with the exercise. Did you notice anything? Maybe you noticed nothing. That's okay. If you were really paying attention and it was numb, that's acceptable. But most people who do that will find a little something. Well, I just did that. I found a little low-grade pressure in my jaw, more on the left than the right, I noticed. And if I looked really close, there was a little tingling from the jaw up towards the temple on the left. Now, this was level 1 out of a 0 to 10. I mean, I didn't even know it was there until I checked in. I also noticed that as I moved my way down, when I got to the pelvic floor, as I said, pelvic floor, I felt my pelvic floor sort of relax just a little bit. I didn't tell it to relax. I just noticed that happened when I got there. I guess it was a little bit tense. So none of this was something I had to do. I didn't even notice any of this tension was there, but it was there, and it was the current message from my autonomic nervous system to the body, holding just that little bit of tension. I didn't need to fix it. I could just go on with my day, but I took a moment to train the brain, because right now, if you had any similar experiences to what I did, your brain is doing a little calculation. It's processing that information. That was a learning experience. And it's saying, wait a minute, you just looked at body tension, granted, level 1, level 2, stuff we didn't even know was there until I looked at it. You just looked at it and you kind of went, looked at it closely, and then you moved to the next thing. You didn't try to fix it. You didn't run away from it. You didn't tell me to calm down. That's a learning for the brain. The brain just learned that you can have bodily sensations without fear. What we just did really is we used curiosity to get away from fear. We're building a different neural circuit here. The old neural circuit is sensation, sensation, or sensation, run away from it. Sensation, I better ignore that. As long as it's mild, I'll ignore it. We're practicing having and observing and sitting with the sensation and just going, look at that, and moving on to the next thing. Super simple, super easy. I don't expect you to feel better after it, but I can guarantee you that your subconscious brain is processing that little experience as something different. I had a body sensation, and I didn't run away from it. And I didn't ignore it. I actually paid attention. I didn't know I could pay attention to bodily sensations without having to change them or do something or react in some way that was a little bit uptight. I just watched it. Interesting. Let's practice one more exercise. Quick type of body scan, just slightly different body scan, even shorter than the last one, but same idea. We're going to go towards a sensation. And in this one, we're just going to ask a single question. Again, we're going to get curious about the sensation, using curiosity as the antidote to fear. I often feel like the opposite of fear is curiosity. If I'm afraid of something, I'm not looking right at it and going, what's that? I'm running away. When I look at something with curiosity, I'm showing the brain that it's possible to have this sensation with something other than fear. And I'm doing so in a very explicit way with a very explicit type of exercise. Maybe even formulaic. That's okay. The brain's going to learn. Okay, so stick with me. This will be about 10 seconds. Right now, find an area of tension, discomfort, constriction, tightness, anywhere in your body. Find an area. And then ask yourself, is the sensation I'm noticing more intense on the left side or the right side of my body? Look closely. Maybe it's 50-50. That's acceptable. Is it really 50-50? Done with the exercise. So those are two simple exercises, ways to check in with your autonomic nervous system and just see what it's doing. We're not telling it to do anything. We're not trying to convince it to stop or calm down. We're just sitting with sensations in a different way than we usually sit with sensations. And because it's difficult to sit with really painful sensations or severe anxiety sensations, we do this when we're not having severe anxiety or severe pain. We're still teaching the brain that the body's a safe place, because the root of all of this is some perception by the brain that's gotten overprotective, and it's perceiving bodily sensations, whether those are pain or anxiety sensations, as, that could be a problem. And they have been a problem. Caused you maybe untold disability in some of the worst cases. It screwed up your days, screwed up your nights. But right now, at this second, these things aren't dangerous. We have this new understanding that these are neural circuits, and I'm going to allow them to happen for just a few moments and going to watch them with a bit of curiosity, and then I'm going to move on with my day. So what I like people to do, or what I suggest that a lot of people do, is set an alarm on your phone or your watch. Maybe it goes off every 60 to 90 minutes during the day. And when it goes off, you stop and you say, oh yeah, I got 30 seconds. Let me do a quick body check-in. And you do move down the body, or you ask yourself one question. Or you could, when that alarm goes off, do one of my active mini meditations that I talk about in some other videos. Those take 5 seconds. Even that's enough. If you're doing this once an hour, once every 90 minutes during the day when you're awake, maybe you do it 6, 7 times during the day. That's enough. You've given the brain plenty of different experiences of having the sensation and doing something different, having bodily sensations with some version of safety. Because when I'm curious about things, I'm feeling safe. So see if you can insert some curiosity into your day. You might help to set an alarm the first day or two. A lot of people I see after the first day or two, they tell me, I don't need to set an alarm anymore. I kind of got used to checking in with my body. I got used to dropping the shoulders. I got used to doing one slow, deep in and out breath. I got used to checking in with my body and noticing where the tension was, not to try to fix it, just to notice, you're doing that again? Oh, I see. And just in the noticing, you're giving your brain a different experience. You're showing it that the bodily sensations aren't dangerous. And you're starting to help this primitive survival brain realize that your body is actually a safer place than it had previously understood. So I hope that helps somebody out there. A little thing to try right at the beginning. Keep diving into this if you're new to this idea of mind-body medicine. This is just scratching the surface of super easy, basic tools. You could watch my TED Talk. I talk more about the active mini meditations. I've linked that in the description below. And I wish you the best of luck on your journey with chronic pain, anxiety, tension, stress, other neuroplastic symptoms, whatever you're dealing with. I'm glad that you're here. I'm glad that you're taking this different approach, because this is the way out for so many of my patients. If you like videos like this, hit the like button and hit the subscribe button, and I'll see you next time. This is Dr. Brad Fanistil at BoulderMindBodyMedicine.com.